Hello everyone. Today we have the privilege to interact with the renowned intensive care specialist and the director of the Neonatal and Pediatric Intensive Care Services of Surya Mother and Child Super Speciality Hospital, Pune, Dr. Sachin Shah. Hello sir.
Hello.
Today we would like to know from you about the intensive care services provided at Surya Mother and Child Super Speciality Hospital and spread the awareness about the same amongst the parents. So first of all, kindly tell us about the factors that make Surya Hospital the go-to place for the intensive care services for children and neonates.
The Neonatal Intensive Care Unit at Surya is the largest in the private sector. We have 35 beds in the NICU and 15 beds in the Pediatric Intensive Care Unit. Newborns between 0 days, premature newborns up to 1 month of age are managed in the Neonatal Intensive Care Unit, which is the largest of its kind in the city, and the infrastructure is comparable to the best in the world. And our USP is that not only infrastructure, we also have the clinical expertise which is available round the clock to manage these very complicated babies. And we are pioneers of this concept in western part of India. As far as PICU is concerned, we have a dedicated 15-bed PICU where we look after critically ill patients who have medical or surgical problems. And again, the infrastructure there is of the highest standard, comparable to the best in the world.
Where do the interventional services provided at Surya Mother and Child Super Speciality Hospital stand at national and international level, and how do you benchmark it?
We look at few parameters. One of them is a survival rate. So when we benchmark our survival rate for very small babies, so small babies, I am talking about babies who are born prematurely at less than 28 weeks. We call them extremely preterm. A baby who is born at less than 36 weeks is a preterm baby. And when I benchmark our survival rates of less than 37 weeks, the survival rates are over 99%. And our survival rate for premature baby for less than 28 weeks is also above 90%, which is the highest in the country. And that is comparable to, say, developed countries like Canada or Australia and United States. So our outcome data which we have published is the best for extremely preterm infants in Indian scenario. There are various scoring parameters on which the patient is scored. And higher the score, higher is the mortality. Simple logic. So in such sick patients also our survival rates are very high, and that is how the quality of care is benchmarked all over the world.
Most of the parents are curious to know what actually happens inside an ICU for newborns or children.
Okay, so those are two different questions, like what happens to a premature newborn. And to answer that, in our NICU we have a lot of small babies who are coming for various reasons. The prematurity incidence has increased. A lot of preterm babies are born, and you must have read in the newspapers that India is the capital of preterm births in the world. So what we try and do is create an environment which is suitable or similar to mother's environment, which is suitable for the growth of the baby. So something like an in utero environment is created outside. Obviously all the organs are immature and they are not functioning to their optimum level, and we support those immature organs with various life support systems till they mature. That is in a nutshell what we do in an NICU. So say a baby who is born at 24 weeks, 25 weeks will need 8 to 10 weeks for the organs to mature. Because why does God keep the baby inside the mother's womb for 9 months, 9 days? That is because it takes that much time for maturity to happen. So we provide that environment so that the maturity can happen outside after delivery. In the Pediatric Intensive Care Unit, our focus is on family-centered care. We try and make sure that the patient's family is involved in the decision making and in the care of the patient. We try and take care of the pain aspect and other emotional aspect, which is our USP.
What does your team in the NICU do to get the best possible outcomes for premature babies?
That is very important information, parents of all newborns. Our USP is that ours is a consultant-driven unit. So which means we have consultants who are well qualified in the field of neonatology to look after these sick babies 24 hours, 365 days. And I can proudly say ours is the only unit in Pune and maybe in Maharashtra where these facilities are available. And this we have been doing for the last 15 years. So the moment we can identify if a baby is becoming sick, and the baby will get the best possible treatment in a very shortest possible time. So that is our USP. Our second USP is that the nursing ratio. We have very high nursing to baby ratio. That means a sick baby is allotted only one dedicated nurse. So which can be like for 3 to 4 weeks, we have 1:1 nursing care, and maximum we can have 2 babies per nurse. And those are the things where we stand out from rest of the NICUs in the country. And if you look at these benchmarking indices, they would be even better than what is being offered in developed countries. What are the things that they need to keep in mind when they choose an NICU? Obviously, clinical expertise, infrastructure, round-the-clock availability of consultants, supporting consultants like maybe a cardiologist, a hematologist, surgeon, very, very important in the NICU as well as PICU. So all supporting services have to be available 24 hours, 365 days.
One very important question from parents' point of view. If they are anticipating a premature delivery, what will be your advice for them to ensure the better outcomes for a preterm baby?
Parents have to remember that, like, in order to get a good outcome, you have to go to a place which is high volume setup and who manage these patients regularly. So the outcome of small babies is best in tertiary care centers where these babies are regularly being treated. So instead of delivering the baby outside and then referring to Surya, if there is an in utero transfer to a tertiary care NICU setup hospital and the baby delivers in that setup, then the outcome is better as compared to if they deliver outside and then they get referred here. So I would like the parents to be aware of the fact that, God forbid, like the pregnancy should go up till 40 weeks, but if they anticipate that they are going to have a premature baby, they should deliver in a place where tertiary care and ICU facilities are available. And that is very, very relevant for all babies who are born before 32 weeks. All NICUs are not the same. They have to understand. So they will have to do some homework from their side. They have to do a background check, background verification of the NICU, the doctors who are looking after the NICU. And it is always good, I always tell them that they should visit the NICU, meet the doctors who are managing that NICU, look at the results, and then choose. Ask for survival statistics. Ask for the experience of the team and then take a decision.
Thank you so much, sir, for enlightening us on intensive care services for newborn and children, and this will help in spreading the awareness about the same. And thank you, viewers. I hope this video will be useful and helpful to all of you in knowing about the intensive care of newborns and children. Thank you.
Thank you, Dr. Rasika. Thank you, everyone.